groups that we do, it's achieving better communication. So we do oromotor exercises which help strengthen muscles and realign muscles that the children have difficulty with. But what we're really looking at is, for familiar words, is we look at how many syllables are in each word and what sound is at the beginning of those syllables. So say for your name, your syllables would be a H and a L, because it's Hey, Lee. So it's 2 claps, and they're the 2 sounds. They're the sounds that our children tend to miss out, which is the sounds at the beginning of the words. Hey, Lee. Do you want to try it?
Hayley.
Hayley,
Yeah.
is that right, Hayley?
Yeah.
Is it 2 claps?
You think?
Hey.
Fantastic!
Great.
Good job. So a clap is your syllables. So we use clappy hands, and just because it's a visual thing and the kids like doing high fives on the table. And once they know that technique for familiar words, when we're looking at new vocabulary and longer words, so stuff like trampoline or gymnastics, exercises, our children have a tendency to miss out the middle syllable of the words. We're not 100% sure why. It could be that they've got poor breath control. It could be that they just didn't hear or can't remember what's happening within the word. We're glad you came along. Now listen while we sing our song. Say hello to everyone. Hello.
What can we as a society do to give children with Down syndrome the support that they need to grow into young, confident adults? Do we need more groups like this? Are we still a bit ignorant as a society?
It's things like taking your time. When you ask a question, they need time to process it. And it's having stuff like maybe learning a bit of sign. You know, little things that will help our young children, young adults be able to communicate with people. So having like easy read menus, maybe a bit of symbols, bigger writing. We need to change how we interact with them. And if you are talking to someone, you talk to the child and not necessarily the parent. And I think that's actually quite across the board from children through to adulthood.
It's funny because when we came in, I asked Nikki what her son's name was, and she said to me, "What's your name?"
What's your name?
I thought I felt that at that moment. I thought I've just been guilty of what probably a lot of people are, and not speaking to the child because you don't know how to, and it's just that breaking down those barriers of communication.
You just have to kind of just drop your barriers and just speak to them, because actually they're just as nervous as you are, but they'll be able to tell you. And to be fair, the child, if they're not able to speak, they'll always look up at their mum and get a wee bit of reassurance if needed.